reasons for consultation is colitis. Next history of present illness. Patient is a 43-year-old lady whose past medical history is notable for hypothyroidism, gastroesophageal reflux disease, depression, mild and situational secondary to current issues with divorce, parentheses close, and history of ulcerative proctitis diagnosed 6 to 7 years ago. Period. At the time of the original diagnosis, the disease is limited to proctitis and was treated successfully with Canassa suppositories with good relief of symptoms. Period. She was not placed on any maintenance drugs such as Isocol. Period. Current symptoms started a few weeks ago and just gradually got worse and are characterized by fairly significant episodes of bloody diarrhea, up to 7 to 8 and sometimes 10 bowel movements a day. Period. For the last 10 or 12 days, hematochezia has become a persistent issue. Period. She has been also having some lower abdominal cramping pain, mostly on the left lower quadrant side. Period. The pain is described as colicky in nature. Period. Patient was seen by Dr. Sweeney last week, and at that time, the symptoms were not as severe. Next paragraph. Patient denies any history of weight loss. Period. She does, however, seem to believe that she has been feeling quite pulled down and feels fatigued. Period. From an upper GI standpoint, the acid reflux symptoms have been present for some years as well, and she's had an upper endoscopy and was prescribed a proton pump inhibitor. However, she went off of dairy and gluten and feels that the acid reflux symptoms are much better controlled without any treatment. Period. Next paragraph. Past surgical history is significant for an appendectomy and a cesarean section. Period. Next paragraph. Medications at home include Levoxil, Lexapro, and in the past a proton pump inhibitor as well. Period. Drug allergies are identified to penicillin and morphine. Period. Next paragraph. Family history is notable for thyroid cancer. Next paragraph. Social history is notable for the fact that the patient is married but currently going through divorce proceedings. Period. She is a trader by occupation but has not worked for 16 years. Period. She has 4 young children who are all healthy. Period. There has been considerable stress in her life because of the issue of divorce and situations pertaining to that. Next paragraph. Physical examination reveals a very pleasant lady who is in mild distress and appears pale. Her vital sign is stable and she's afebrile. Period. HNT exam is notable for a supple neck. There's no ictus. Mild pallor is noted. Oral mucous membranes are reasonably moist. Chest auscultation was clear. Cardiovascular exam revealed a regular rhythm. I did not appreciate a murmur. Abdomen is scaphoid and thin but fairly tender, especially in the left lower quadrant. Period. There is no guarding or rigidity and pulse on the heart. Period. Lower extremities are without any edema. Rectal exam is deferred at this time. Right. Next paragraph. Laboratory data are reviewed and are notable for an increased sedimentation rate of 33 in a C-reactive protein, which is also elevated at 3.3. Hemoglobin 12.3, but may represent hemoconcentration and electrolytes are normal. Next paragraph. At this time, it appears that patient has had remote history of ulcerative proctitis, which now appears to have increased and probably has extended itself proximally to